Hey everyone, Dr. Rob here. I want to take a moment to spotlight my sponsors, Professional Co-op, empowering clinicians with premium access to top-tier lab services at a fraction of the cost. Since 2001, Professional Co-op has redefined what efficient, patient-centered support should look like. No hidden fees, no minimums, and you only pay for completed tests. It's lab access made simple, transparent, and affordable. Trusted by licensed healthcare professionals across the country, Professional Co-op is your strategic partner in delivering high-quality care. Discover more at www.professionalco-op.com. A quick shout out to my other sponsor, Functional Medicine University, one of the top online programs for learning functional medicine. Founded by Dr. Ron Grisanti, FMU has trained thousands of healthcare professionals in over 50 states and over 68 countries. It's completely online, self-paced, and CE approved for a wide range of clinicians, MDs, DCs, NDs, PAs, and more. At the end of the program, you earn your certified functional medicine practitioner credential, something that's truly elevated my clinical approach. If you're ready to level up your practice with evidence-based root cause care, FMU is the place to start. Check them out at Functional Medicine University. Hey everybody, Dr. Rob Silverman here. I've got functional medicine superstar, Dr. Heather Stone. She is known for her book, which pertains to thyroid issues. And we're going to cover the thyroid, we're going to cover autoimmunity, and we're going to cover everything under the functional medicine veil. Dr. Stone, it's my pleasure.
Thank you for having me.
So I'm going to give you a summary. Healing thyroid dysfunction requires addressing the underlying immune, gut, adrenal, and environmental triggers, not just masking symptoms with hormones, and demands a precision, root cause driven, and lifestyle integrated approach. Have you heard that before?
Very much so.
So the real epidemic is actually undiagnosed thyroid dysfunction and mismanagement of thyroid. Would you like to take the baton from there?
Absolutely. So I think it's important to understand that there are so many women who've been diagnosed with low thyroid, and they go to the doctor and they say, okay, I've got all the typical symptoms. And nowadays we can ask AI and we can ask Dr. Google, and you type it in. I've got low energy, I can't lose weight, I'm not sleeping well, I've got anxiety and depression and brain fog, and my hair is falling out, and it's going to say, okay, you have low thyroid. So you go to the doctor and they do a very minimal test, typically a TSH, and they say, okay, you have low thyroid. And
Mhm.
here's your thyroid medication, and you're going to take it for the rest of your life, but everything should be great. So the ladies are thinking, okay, I'm going to take this pill. And if everything is great, then I have no problem taking this thyroid hormone or this thyroid medication. But unfortunately, you may feel better for a short period of time, but almost always all of those symptoms come back. And it's very disappointing to think or have your expectations set that this medication is going to fix all of these things, and all of your problems are hanging on this just low thyroid diagnosis, and that doesn't seem to be the case or fix the issue. And we continue to live a life trying to figure out why we still have all of these symptoms, and so many women give up because when they keep going back, it's like, well, of course you're going to have these symptoms, you have low thyroid, of course this is what it's going to be like, you have low thyroid. And then they get the antidepressants and anti-anxiety and the sleeping pills, and it's one pill after another. And I think ultimately, when you dig into low thyroid, the number one cause of low thyroid is almost never checked for. It is never addressed, and it continues to get worse over time, which is why we still suffer with symptoms, even if we're taking thyroid medication, and even if maybe those thyroid markers are now normal when you go back to the doctor's office.
I assume women are more susceptible to a thyroid issue because 80% of the people who have autoimmune conditions, spoiler alert, are
Yeah.
females.
Yeah.
Is
The
there
other,
any, sorry, is
go
there any
ahead.
particular reason why? Why ladies? Why are you unfortunate? I'm not.
Well, I don't know if there's hard evidence, but what I have seen in clinical practice is that usually this Hashimoto's or autoimmune condition, it turns on when you have big hormonal fluctuations.
Mm.
So I see it during puberty. I see it mostly after the birth of a child. I see it as you go through menopause, or your symptoms get worse as you go through menopause because we have these big hormonal fluctuations. Now, men don't typically have these big fluctuations in their hormones, but I have seen men who have Hashimoto's and low thyroid, and it often is triggered by big moments of stress or trauma. So, I think there's very few occurrences of men who have Hashimoto's, but it does happen, and low thyroid, but mostly it's women. And I truly think it's because we have these big hormonal shifts. And one of the underlying triggers is estrogen and testosterone surges. And so that's usually what I can see as the culprit or the trigger. But also in females, major stressful events will also turn it on.
You made a really good point that people just test for TSH, and probably the bulk of the reason that people have a thyroid problem is it's autoimmune, they're attacking the gland. Why isn't the model, now obviously the functional medicine model covers this, so this is not a novel idea, root cause resolution, if you will. But what seems to be the problem in the other model? Why is this occurring? And what labs would you recommend for somebody to get a proper thyroid profile?
Yeah. So, first of all, in traditional medicine, they're usually just running TSH, right? And the interesting thing is TSH isn't even made by the thyroid. TSH stands for thyroid stimulating hormone, and it's made by the pituitary gland. And that tells the thyroid to make thyroid hormones, tells it how much and when to make thyroid hormones. All right. So there could be many other reasons why your TSH is up or down. But traditionally in traditional medicine, they just looking at the TSH, and they adjust medication or give medication based on if that number is up or down. All right. Which is very simplistic. But at the end of the day, like if they were to do all of the testing and look at Hashimoto's and look at all the other patterns that we see with low thyroid, they don't have the tools in their toolbox to really address those issues, right? So they have thyroid hormones. They have T4 and they have T3 if they want to dig into that. Some doctors don't even like to address any kind of issues with T3, and they just give T4 hormones. And so they aren't really set up to say, okay, this is an autoimmune condition. What do we need to do to balance the immune system? In traditional medicine, when you have an autoimmune condition, they essentially give you drugs to shut down the immune system. I was talking to a lady yesterday, and she had Hashimoto's and she had MS. And I said, okay, so tell me what's been your path lately? And she was like, well, I did this low dose chemotherapy medication, and the doctor said I was going to be fine. For once I was done with it, I wasn't going to have any issues with MS. And I'm like, okay, that's interesting. But she's now got Hashimoto's, or antibodies were like over 2,000. And she was still having major issues with MS. But essentially, they just shut down the immune system. But a functional approach would be, what is it that we need to do to balance the immune system? What are all the underlying triggers that are causing the immune system to attack the body? And then that really guides care. Now, you asked me a question: what thyroid markers or what labs should people do to get a thorough evaluation of their thyroid? And there's actually 12 different markers that make up a complete thyroid panel. Now, I don't know if I can do those all from memory at the moment, but I certainly will give it a shot. And I can give you, for your readers, a free downloadable so that they can download all 12 of those markers with the functional ranges. We should probably just do it that way, because I don't know if people are writing a list right now while they're listening to the podcast, but I can give you guys a free downloadable. So it has all the markers, it has all the functional ranges, and a little blurb about what each of those markers is and kind of what it is that we're looking for when we run these markers, so that we can see other things that happen with thyroid physiology, not just how the pituitary is communicating with the thyroid.
That would be great. We'll put those in the show notes. That would be outstanding. Can you hit some of the big ones? T4, T3,
Yep,
reverse?
absolutely.
Yeah,
Yeah.
great.
So TSH is the one that's so obvious, right? It is important, right? So we want to look at the TSH to see what's happening. But you also want to look at total T4 and free T4. You want to have both of those. You want to look at total T3 and free T3. You want to look at reverse T3, T3 uptake. We look at thyroid binding globulin. We look at FTI, which is free thyroxine index. And then you really want to look at the antibodies because the antibodies are going to be a good indication if you're dealing with an autoimmune issue. And so that would be TPO antibody, which stands for thyroid peroxidase antibody, and the thyroglobulin antibody. That you run those antibodies if you have low thyroid and you're looking for Hashimoto's. Now, there is a third antibody, which is thyroid stimulating immunoglobulin, and that is more of a marker for Graves' disease, and that's an autoimmune disease, which you would typically be in hyperthyroid, so overactive thyroid.
So let me ask you, the medical field, and I'm not an anti-medical doctor, some of my best friends are. We're just talking about some of the things that we find, some of the blind spots in the testing. They simply prescribe a synthetic T4, but that's quite insufficient for true healing. So many of our patients are on this synthetic drug, and we're not anti-drug. It's just a drug that probably doesn't work adequately. Can you expand upon that?
Sure. So when you take a synthetic hormone, so levothyroxine or Synthroid or even tyrosine, the body has to convert that into a bioidentical form so that you could actually use it. And then the most interesting thing is the bot T4 is mostly inactive. So your thyroid mostly makes T4, and then we're taking levothyroxine or one of those synthetic T4 hormones. So the body actually takes that and converts it into T3, which is the active form of thyroid hormone. All right. So that's how the body regulates its metabolic rate is by how much how much T4 it converts into T3. And that's what regulates your metabolism. And so a lot of times we will have an issue with under conversion, right? So we're not converting enough T4 to T3. So someone could have a completely normal TSH. And if the doctor was a little bit more progressive, they run maybe a total T4 and maybe they run a free T4 and everything looks great. This literally just happened to me yesterday. And the patient was like, after I listened to your masterclass, Dr. Heather, I went to my doctor and I said, I really think something's going on with T3. And her endocrinologist says, I don't deal with T3. So you can maybe find another doctor or go back to your primary care and ask them to run the T3. And so she had labs done with me. And sure enough, her T3 was so far below the lab range. Like TSH normal, T4 total and free normal, but total and free T3 were below the lab range. So her metabolic rate was completely turned down. And so then, as functional doctors, for me personally, I don't usually just like to give T3. I want to say, okay, why are we under converting? Like, why is the body trying to slow down the metabolic rate and under convert and slow everything down? And so we dig a little bit deeper to figure out, well, why is this happening? Where is it coming from? Can we address the root cause? And also maybe give some T3 and support the process in the meantime.
Without question, there's two things that I hear that are resonating in what you said. Number one is root cause, no band-aid theory, which is great. Number two, you adhere to the idea of testing and not guessing. Within that, you and I both look at the typical ranges from 18 to 80 in blood labs, and we realize that that's pretty wide range. We also realize that not only is the range wide, it's people who are probably more unhealthy than healthy, but there's functional medicine numbers. Can you tell me the difference between the two and how you got there?
Yeah. So this is just crazy to me. And I've been doing this for so long. It makes me crazy. So the lab ranges that they're getting is just an average of the people going into the lab in that area. right? So all the people that go into a lab in a certain area, they graph their numbers on a bell-shaped curve. They take the median and then they go two standard deviations out, and that's how they get their lab range. Now, they're like you said, it's not the 20 and 30-year olds that are going into the labs. Who's going in and getting their thyroid checked? It's all of us with thyroid problems. And so all of us go in with thyroid problems and we are setting the averages. Now, these ranges have a purpose. They will tell you if you are in a disease state. If you are falling outside of the average and you are way outside, it's like a big red flag. We have a giant problem, but it's not going to tell you where the dysfunction is. It's going to tell you if you have a disease, but it doesn't tell you where is the dysfunction. And so in functional medicine, we're not necessarily just trying to find the disease, although we can find that. But what we're trying to find is where is the dysfunction, and the dysfunction happens outside of optimal. So we can look at research and we can look at where does a human being, male or female, sometimes those ranges are different. What is the optimal functioning range? And if you fall outside of that, what does it mean? And what are the patterns that we can see throughout the lab work that will tell us what is the underlying root cause? All right. So, yes, those giant lab ranges, they tell us if you have a disease, if there is something really wrong, but we mostly fall into the cracks of this process when we have dysfunction, but not disease. These are the people that are like, okay, I am tired. I'm not sleeping well. I'm not really on any medication. Maybe I have a high cholesterol medication. I've got some anxiety and depression. I'm just not feeling amazing. And they're like, well, nothing's wrong with you. You don't have a disease. There's no medication I can give you because there's no disease that we can diagnose. And so that's where we fall into the cracks of traditional medicine. But now it's really starting to move in a different direction. I mean, when I started doing this 20 something years ago, people looked at me like I was literally a crazy person.
Mm.
And now it's like, oh, okay. So we're trying to be optimal. I think a lot of people used to think that being healthy meant that you didn't have a disease. But now we are starting to understand and realize that being healthy means that you're functioning optimal, you have no symptoms, and you certainly don't have a disease. So there is a big continuum of health that we have to really understand. Health is not the absence of disease. Health is the optimal functioning of the body with no symptoms and no disease.
Wonderful. Very well said. Indeed, indeed. Now, you've been doing this over 20 years. We spoke before we came on. You have a book. You talk in your book about the 7 pillars of thyroid healing. You want to give us a nice overview of those 7 pillars?
Sure, and we'll go pretty quick because I could literally talk for hours on these. This is like the blueprint. All right. So this is the blueprint that I have worked with thousands of women, and this is the way that you need to get great results. So the first pillar is that you have to have a consistent goal, right? You have to have a consistent pursuit of your goals. So we got to realize that, okay, what is it that you're trying to achieve? And we really want to make sure that they're measurable. You want to make sure that they're very clear. And then behind the goals, you have to have deep rooted motivation. Everybody wants to lose weight. 80% of Americans will say that they want to lose weight. That's a good goal, but what is the motivation behind why you want to lose the weight? It's not just to look better. It is to be mobile as you age. It is to prevent diabetes or reverse diabetes. Like, you've got to really dig in there and figure out what your motivation is behind the goal that keeps you moving forward. Pillar number 2 is that you have to have comprehensive testing. Now, I wanted to say this earlier, but I kind of went on a rabbit trail. When we're talking about thyroid testing, I'm talking about, there's 12 different markers that make up a full and complete thyroid panel. But let's be clear, about 90 to 98% of the women who are diagnosed with low thyroid actually have an underlying autoimmune condition. And when you have an underlying autoimmune condition, you have to look beyond the thyroid. Yes, the thyroid is important. Yes, if you have low thyroid hormones, that will trigger the immune system to attack the thyroid even more. So the thyroid hormones are important, but you have to expand the scope and look at adrenal function. Blood sugar is a huge one. We've got to look at your gut health and your microbiome. We've got to look at toxins, mold toxins, heavy metals, environmental toxins, and food sensitivities. So we've got to really look at the whole picture and stop just focusing on the thyroid, because once the thyroid numbers are pretty stable and you still have symptoms, there's still a trigger that hasn't been addressed or handled. And it is crazy because if you would take the symptoms of low thyroid, you can put them exactly on top of the symptoms of blood sugar imbalances, dysglycemia. So when you have a symptom, your body's just trying to communicate with you that there is some underlying imbalance that it needs a little help overcoming. And so that's where you find the imbalance instead of the disease. All right. So you've got to have comprehensive testing, and we have to go beyond just the thyroid. And then the third pillar is that you have to have comprehensive analysis and diagnosis. So, like we were talking about, it's not just can we name the disease and match a medication with the disease. It is about where is the underlying imbalance, where is the body not functioning optimally, and what are all the different patterns that the body is showing us so that we can determine what are the highest priorities that are going to move the needle the fastest. And I think if you don't go in this order, this is where people really mess up, because we start from symptom and then we try to apply a solution without understanding the testing and understanding the analysis and the patterns that are happening. So people are literally working on the same problem for years and years and having like failure after failure because, like, let's say they can't lose weight and they're tired, they have low energy, and they don't sleep well. So they asked Dr. Google, and Dr. Google says, okay, we think it's a thyroid problem. So you go to your doctor, you get thyroid medication, and you're on it, and your doctor says everything's good, but you still have these symptoms. So then you ask Dr. Google again, and he's like, okay, I think you have a blood sugar problem. So you go and you take cinnamon and you maybe try a paleo diet, and you kind of still have these symptoms. And you ask Dr. Google again, he's like, maybe some adrenal. So you go to your local health food store, and the person in the aisle is like, yeah, take this adrenal supplement. So we're like taking all these supplements. I used to laugh when I was in physical practice. I always knew when a thyroid patient walked in because she had bags and bags of supplements. And I can laugh because I have Hashimoto's myself, and I have, been down this road, which is why I do what I do. But we keep trying to apply a solution without knowing the root cause of why we have the symptom, right? So we go from pillar 1 to then pillar 4, which is customized care. And if you're going to customize care, you have to have the labs that dictate which direction you're going, what path you're going, so that you can get the best possible results in the shortest amount of time. I will be talking to a patient and they will be like, I've been dealing with these symptoms for decades. And I'm like, okay, your treatment plan is going to be 8 months long. And they're like, 8 months? Like 8 months, you're going to have all of this fixed? I'm like, probably so. The chances are very high because we do very specific. We create treatment plans with data, and we continue to retest, which is pillar number 6. And then we recustomize care, which is pillar number 7. So you go through this process where it's very data driven and we're not guessing. Now, I skipped one pillar, which is pillar 5. And this is that you need a coach. You need somebody who's been there and done that so that you don't have to reinvent the wheel. But the other part of that is that you have to be coachable, because I find even myself, because we've had to figure this out on our own, and we've had to We've had many bad experiences with different practitioners. Sometimes it's hard to trust and be coachable. And there's always a new advice going around on Instagram and Facebook about what we should be doing now, and what we were doing is not what we should be doing. And so it
Oh my
just creates a
gosh.
bunch of confusion.
I agree with you. I think everybody needs a coach. I have a coach. I'm sure you have a coach.
Yep.
So the idea is essentially to extrapolate, check the symptom so you can get to the system to ultimately get to root cause resolution. So you're going to test, you're going to treat, you're going to retest, and hopefully you get them to optimum outcome, and therefore you're going to maintain.
Yep.
So with that being said, give me three heinous foods that will guarantee, well, we won't say guarantee, but give me your three worst foods for the gut and the thyroid.
Okay. Three worst foods. This is not hard. Number one is gluten. Gluten, it will wreck your thyroid, it will wreck your brain and cause inflammation. And I didn't understand this when we first started learning and understanding about gluten like 20 years ago. And I also would be gluten free for during the week, and then maybe I would cheat on the weekends. But now what we know is that when you eat gluten, those antibodies stay circulating in your system for up to 90 days or more. So when you eat gluten, there's a thing called molecular mimicry, and the molecule of gluten looks very similar to the molecule of your thyroid and to the cerebellum of your brain, which tells you where you are in space. It helps with balance and coordination. And we're even learning that now it helps us with coordination of thought. So gluten is probably the worst thing that we could eat, and you can't be kind of gluten free. It just doesn't work like that. So you've got to like make the jump. The thing that helped me the most was when I think about gluten, I just think about it destroying my thyroid and my cerebellum. And I have in my mind, I think about it like rat poison, which is why I'm never tempted ever, because I know the detrimental consequences of gluten. And you could sit chocolate chip cookies on my desk and I would not touch them. And it's just because I've made that shift in my brain that it's rat poison and it really could be super detrimental. And then I also think, oh my gosh, when we have one autoimmune disease, we are at a high risk of developing multiple autoimmune diseases. And I certainly don't want to deal with that. So when you make that shift in your brain will actually start to work for you, and you won't feel deprived of getting rid of gluten. All right.
I'm not trying to take a detour, and
Go
I'm
ahead.
sorry for interjecting. So you and I are both on the lecture circuit. So I get to ask the question that I'm asked all the time. So gluten, okay, I get it. Gluten means glue. It sticks to my intestinal tract. Wow, I can't believe it's 90 days. That's if you're celiac or sensitive, which is 4 out of 10 people combining those two. So if I'm in a 6 out of 10, I can eat gluten, right?
Well, I have seen some research that is suggesting that 100% of the population in America is sensitive to gluten, regardless if they have a test that says if they're sensitive or not. Now, the other thing to think about gluten is a grain, and it usually is in a grain form, right? So when you eat grains, it will raise your blood sugar. You will get an insulin spike, you will get a blood sugar spike, and it's going to wreck your metabolism. And if you are like 80% of Americans who have a weight problem, avoiding gluten and grains is probably one of the best things that you could possibly do. You cannot calm down the immune system if you constantly are having insulin surges. And it is extremely difficult to lose weight if your body is full of insulin, which is a fat storing hormone. So you can't expect the body to utilize fat as fuel when it has all this extra fuel that it's trying to save for energy later. And so it's two of the biggest problems that we face is obesity and autoimmunity and blood sugar issues. And so, gluten causes not only inflammation in the gut, the thyroid, the brain, it also causes insulin surges, and it really creates issues with our weight.
That's a great takeaway because, I hear a lot of people lecture on the gluten and the fact that you and I both don't eat any gluten because the gluten in America comes with glyphosate and Roundup, and we won't go down that rabbit hole at all.
Yeah.
I'm just going to say for me, everybody should be anti-gluten. Yes, the gluten, or I should say, yes, the bread is a little different in Europe, but gluten still has something called gliadin.
Yep.
and that's going to be the zonulin and all that. But a really good point about the fact that grains raise your blood sugar, creating a pro-inflammatory milieu in the body. So you owe me two more foods.
Okay. So the other food is dairy.
Mm.
For me, this is just a big one. And I know there's a lot of controversy right now, especially on the carnivore circuit. And is dairy okay? And is it not okay? And I find that the people that don't do well on carnivore, they're usually eating way too much dairy. And dairy, it's inflammatory for us. We don't have the enzymes that we need to break down these big dairy molecules, especially casein. Like when our body is built to break casein down up until about the age of 5, okay? Because there is natural casein in human breast milk. However, cow's milk has about 32 times the casein. Goat's milk has 16 times the casein as human breast milk, and sheep's milk is about the same as human breast milk. However, we aren't supposed to be drinking milk after the age of 5, right? And I think, if we had a toddler running around that was 5 that was still breastfeeding, you might get some weird looks. Although the body is still designed to break down casein up until the age of 5, but otherwise, the after that age, we can't break down casein, and it creates a lot of inflammation. The other thing to think about is, milk. It's meant to grow a baby fast, right? Like that is the purpose of milk, is so that we can grow this baby to be self-sufficient as fast as we can so that it's not in danger in nature. And I don't know about you, but I am not trying to grow. I'm not trying to grow like a baby cow. It has lots of insulin like growth factors. It's got all these hormones to grow the tissue really quickly. And when you take cheese, it takes 12 pounds of milk to make 1 pound of cheese. And you're like concentrating all of those hormones into cheese. And yes, it is delicious, but just think about, what that is doing to the body. And we have this obesity epidemic and all these inflammatory conditions. And I think that dairy is probably something that we just should avoid. And then people ask me, what about raw dairy? And what about A2A2 dairy? And you're like, okay, it still has casein. It's probably better, but it still has casein in it. I live on a ranch and I have 3 A2A2 cows, and we do milk the cows. But what I use the milk for is if some other animal on my farm doesn't get breastfed, or the mom kicks it out or something like that, we use the milk so that we can raise other animals without having to get all the powdered, junky milk that they sell at Tractor Supply or something like that. But anyway, I think casein is a huge one, and it creates loads of inflammation, and it can mimic gluten. There is a cross reactivity between gluten and dairy. So it's almost like for many people, you're eating gluten when you eat dairy.
Great points. So to recap, too much casein versus human breast milk. You
Yeah.
gave some great examples. We as humans can break down casein at the up to the age of 5, and after that, we're kind of lost. Milk is really the means of growing a cow, little calf to a cow quickly. And I certainly don't want to have the body composition of a cow. I appreciate that. Yeah, this really goes to, I always said we're the only species that wants to drink another species' milk, hence the idea of consuming cow hormones, concentrated cow hormones, and casomorphin. I
Yeah.
mean, it gets
Yeah.
us drunk.
Yep, it can. And it's very addictive. It's like an opioid. And so that's why people get so upset when I have them get off of dairy. I'm like, just know the reason you're having that is because you're probably addicted to it. So you'll get over it.
So, for a thyroid issue, give me the best diet per se.
I would say that you want a very low carbohydrate, no sugar, and high protein diet, right? So you want to really focus on protein. Um, and you want to make sure you're having good fats. And for me, I really try to focus on mostly green veggies, but taking into account like oxalates and minimal lectins. Now, so usually that is the best because the ultimate thing is that you have to regulate your insulin surges and you have to regulate your glucose and also making sure that you're getting rid of the foods that are very inflammatory. So that's what I have seen to work the best is mostly green veggies minus the ones that are super high in oxalates like spinach, Swiss chard. All the other ones are pretty much for the most part okay. And then you want really high protein, 0.75 to 1 gram of desired body weight of protein.
Without question on the protein, it is the miracle macronutrient. We forgot the third food. I'll plug it in because we don't want to go back. It was soy.
Yep, soy. I mean,
Soy. I
it's a
read your
toss
book.
up. We can do soy, we can do corn, we can do sugar. But either way, yeah, soy
Now, when
is
you say sugar,
mhm,
you're talking cane sugar, fructose, or both?
both.
Okay.
I'm
But
talking both. So this is cane sugar is obviously not great, right? Because it raises blood sugar. It's going to make us gain weight. It contributes to obesity. Fructose also will do that. And so most of my patients, we see that they have a fructose metabolism issue. And when they eat any kind of fructose, like their blood sugar will really spike. For example, I wear a continuous glucose monitor just because I'm obsessed with my blood sugar. And I got stuck somewhere and I didn't have a protein bar and I had an apple. So I'm like, that's the best thing for me to eat. So I ate an apple and my blood sugar went over 140. I'm like, oh my gosh, this is crazy. So most of the time, if there was nothing else to eat, I would eat an apple, but you can absolutely overdo the fructose. So for me, I pretty much stick with a handful of berries. Other than that, I don't eat any fructose. And certainly honey will really spike your blood sugar, which is also a form of fructose. And so is agave. So all of those things will really spike your blood sugar. And so for women who are trying to, number one, stabilize their immune system, but also release weight, you have to regulate your blood sugar. And I really like the tight range of being anywhere from 80 to 120, but not going over 120 after you eat, and also not going under 80 when you're sleeping at night. So low variability and not a lot of change even throughout the day.
wonderful insights. Now, I'm from New York, so we have this section that we love. It's called rapid fire. So I'm going to
Okay.
give you something, and you're going to try and be concise, answer it, and give a pithy type of response. So you ready?
Okay.
I know you're from the southern part of Texas, so here we go. Hello, Dr. Stone. Your labs are normal. It's just aging, my other doctor said.
Oh my gosh, this is supposed to be really quick. So there's no such thing as a disease related to aging except for sarcopenia. So it's not an aging issue.
You can take more time with that one. It's okay.
Okay.
Each
I'm
one
like,
can
I could
be
spend an hour on this. All right. So
each one can be rapid fire. How does that sound? Each one is
okay,
the allotment
that's
for it.
that's fine. So aging, I feel like they've just run out of information or they don't want to spend the time to dig to figure out what's going on underneath the surface. All right. So when you get the answer of aging, it doesn't give you any solutions and it makes you feel stuck and it makes you give up and it makes you hopeless. But I have worked with patients that are in their 80s that are reversing diabetes, losing weight, and really turning things around. The body is designed to heal. You are born to heal. And it doesn't stop trying to do that until the last breath that you take.
Outstanding. You need just to eat less and exercise more because if you eat less and exercise more, you'll take in less calories because we all know we count calories and you'll burn some more. And Dr. Stone, I've been doing that for the last 6 months, and guess what's happened? I haven't lost anything and I'm freaking hungry.
Yep. So there's one word that I would say with that is it's insulin. You have to look at the insulin response. So you can eat 500 calories of chocolate chip cookies and you can eat 500 calories of chicken, and you're going to have a completely different response in the body. And the person who eats the chicken is going to lose weight. The person who eats 500 calories of chocolate chip cookies is going to either stay the same because they're limiting their calories, but their body fat's going to go up. They're not going to feel great and they're not going to get great results. It's not about the calories. It's about the insulin response in the body.
My TSH numbers are horrible. The doctor told me drugs are my only answer.
So that's not usually the case. And sometimes you might need thyroid medication, but it's usually only one small piece of the puzzle. And you got to look at the root cause. Why is the thyroid numbers a mess?
I know you're picky, particular about who you admit as a patient in your practice. What are the basic criteria you use to make someone or to determine if someone is a good fit for you, where you can help them?
Yeah. So your health has to be your number one priority
Mm.
over anything, right? Because the people that their health isn't their number one priority, I find myself caring more about their health than they do. And that's never fun. And you never get great results when you do that. And so the people who their health is their number one priority, we just need to find solutions to the obstacles or the roadblocks. The people where their health isn't the number one priority, they find the roadblocks and it stops them and they give up. But your health has to be your number one priority over anything else.
I forgot to ask you this. Give me the symptoms that are typically associated with low thyroid function so people know, let me think thyroid.
Yeah. So they can't lose weight. They have low energy. They're not sleeping well at night, whether they can't fall asleep or stay asleep. They have anxiety, depression, brain fog. Their hair's falling out, brittle nails. That's typically classic symptoms of low thyroid.
What should a woman look for when choosing a healthcare provider to show them the path to a happier, healthier life?
It depends on the goals and what they're looking for. So if they want a practitioner that's just going to give them thyroid medication, they should look for a traditional endocrinologist. But if they want to understand and get down to the root cause and address these symptoms so that you can resolve the symptom and not just cover them up with medication, they need to look for a functional medicine practitioner.
Three critical labs. You kind of answered this. Everyone should request from their doctor today. It's not limited to just thyroid. So you're empowering now the public to ask the medical doctor. And I'm sure it's not the first time someone's asked you that. I know it's not the first time that it's happened to me, but give me three labs. Better yet, I'll preface it by saying, give me three thyroid labs and then give me three labs outside of thyroid.
Okay, so the top three thyroid labs I would run would be TSH. It's really hard three, but TSH, I would say a free T4 and a free T3. And if I had to do two other ones,
Sure.
I would say the antibodies. But let me say this real quick. I know we're supposed to answer pretty quickly. But these antibodies, if they're negative, it doesn't necessarily mean you don't have Hashimoto's because there's a 20% error rate. Sometimes the immune system gets out of balance and it doesn't produce these antibodies like it should. So, the antibodies aren't the only test. If I have a patient where the antibodies are negative, I just assume that they have Hashimoto's because it's highly likely that they do. And we just get down to the root cause. But I would say TSH, a free T4, and a free T3 are what's going to actually tell you what to do to move the needle. And then the other test that we should have is for sure a hemoglobin A1C because blood sugar is so critical. Now, you can't see everything on an A1C. I actually have a lab panel. It just so happens to have 12 different markers to truly evaluate dysglycemia and if there is a blood sugar problem. So looking at blood sugar is imperative. Looking at like C-reactive protein to tell us how at risk we are for a heart attack and stroke and what our inflammatory markers look like is also very important. And then maybe running a CBC to look for underlying infection patterns because that's really huge as well.
So I have a buddy of mine, and I always go towards the end of the podcast. He listens to them all. He's been a great supporter of it. And he always says, Rob, I need that one thing that I need to do on Monday and I will implement it. So since it's a male and we know that it's mostly females, this is for his wife. What's the one thing?
Okay. So the one thing is you got to get gluten out of the diet. That's what I would say. That is the one thing. If you just picked one thing, that's where I would start.
Outstanding. How about one simple mind shift to kickstart your healing process?
Yeah, I think it's important. I always talk about this, the 2% rule. sometimes we can get really overwhelmed with all the things, right? Like I said, no gluten, no dairy, no soy, no sugar. I always talk about exercise and getting the body moving. And like we got all these things. And so sometimes we become overwhelmed and we don't do anything. I just talked to a lady, she didn't implement anything because she was scared she was going to do it wrong. So she kept making the bad choices. So I'm like, just do 2%. All right. Like if you could do 2% today and then do 2% better tomorrow and 2% better the next day, at least you're moving in the right direction. The people that think they have to do all or nothing, you end up doing nothing and they stay stuck and they have the same life that they had or worse in the next year and 5 years and 10 years.
Last question for you. Where do you think the world of functional medicine will take thyroid evaluation and thyroid treatment in the next 5 years?
The direction that it has been going in the last few years has been exponential compared to where it was 20 years ago. Like literally 20 years ago, no doctors really even knew what Hashimoto's was. Now, most people know, and I think it's going to become the norm. Like I'm hoping that if you get diagnosed with a low thyroid problem, your first option is to go to a functional medicine practitioner. That only makes sense because the solutions otherwise are very surface and they don't really address the root cause. So I am grateful for all of the social media stuff because it has allowed us to disseminate information without the filter of big pharma. So I feel like it's been amazing and it's only going to get even better. And I think AI is going to really help us with that too.
So I'm going to ask one more question. I'm really sorry because
No
I
problem.
love this topic. I'm exuberant about it. Gut testing.
What
Did I
about
just
it?
open up Pandora's box at the end of the podcast?
Well, probably. I mean, again, we could talk forever here, and I think gut testing, is important. I think there are some limitations to gut testing.
Mhm.
And I think, it plays a huge role. Like your gut health is so connected to your immune system and your overall health. However, you can't just focus on gut health because other things are impacting your gut health. So
Mhm.
you've got to look at it in a broad stroke, meaning like a lot of practitioners say, okay, we're going to start with this gut protocol. But if you don't fix your blood sugar, you're not going to fix your microbiome and you're not going to fix your gut. If you don't fix, the foods that you're eating that cause inflammation, you're not going to fix the gut. But I do think it's important. I think it's imperative that we look at the gut. I test every person that we take on as a patient. We do a gut test where we're looking at parasites, bacteria, yeast, fungus. But knowing as a clinician, there are limitations to what we have access to at the moment. But I think AI is really starting to shift our gut health. And it's so cool because there's AI programs out there that can take your microbiome and predict what health issues you're going to have in the next 10 to 20 years. Like, are you going to have any kind of cancers or other major health issues by looking and analyzing your microbiome? So I think we're on kind of the edge of where this whole, the gut health is going to go.
I agree. I think we're on the cusp of some
Yeah.
greatness in reference to really evaluating the gut microbiome, the thyroid, functional medicine, and the like. And you are leading the charge. This has
Uh,
been great. Thanks for your time. Love to talk more. Everybody, Dr. Heather Stone, Dr. Rob Silverman, Proven Health Alternatives.